Holistic healers versus medical doctors. What people over 50 should know. If you're over 50, chances are you've asked yourself this question at least once. Should I trust holistic healers or stick strictly with medical doctors? Maybe you've tried natural remedies that seem to help, or maybe modern medicine saved your life. For many people, the confusion isn't about choosing sides. It's about knowing what actually makes sense at this stage of life. And today, that's exactly what we're going to talk about. Because after 50, your body works differently. Your goals are different. And your health decisions carry more weight than ever before. Let's start by clearing up a common misunderstanding. Holistic healing and medical care are not enemies. They are two very different ways of looking at health, and both have strengths, limits, and important roles. Traditional medical doctors focus on diagnosing and treating disease. They use lab tests, imaging, medications, and procedures that are backed by decades of research. This approach is especially powerful in emergencies, serious conditions, infections, injuries, and chronic diseases that need close monitoring. If you have chest pain, sudden weakness, uncontrolled diabetes, or high blood pressure, modern medicine is not optional. It's essential. Holistic healers, on the other hand, tend to focus on the whole person. That includes lifestyle, stress, sleep, nutrition, movement, mindset, and daily habits. Instead of asking only, "What disease do you have?" they often ask, "Why is your body struggling in the first place?" For many people over 50, that question feels refreshing. Because aging isn't just about one diagnosis. It's about energy, digestion, inflammation, sleep quality, pain, mood, and overall quality of life. This is where confusion often starts. Some people believe holistic healing replaces medical care. Others believe doctors ignore lifestyle completely. Neither of those extremes is true. Medical doctors absolutely recognize the importance of diet, exercise, weight management, sleep, and stress. But their training and time constraints often focus on diagnosis and treatment, not daily habit coaching. Holistic practitioners often spend more time discussing routines, food choices, breathing, movement, and emotional well-being. That doesn't mean they diagnose or treat disease, and ethical holistic practitioners know when to refer someone to a doctor. Here's the key point, especially after 50. Your body is no longer as forgiving as it once was. Ignoring symptoms or relying on guesswork can be risky. At the same time, relying only on prescriptions without addressing lifestyle often leads to frustration. That's why many adults over 50 quietly do something very smart. They combine both approaches. They use medical doctors for diagnosis, monitoring, medications, and serious conditions. And they use holistic strategies to support their overall health between appointments. For example, someone may work with their doctor to manage blood pressure, while also improving diet, reducing stress, walking daily, and improving sleep habits. Another person may take prescribed medication, while also focusing on inflammation-reducing foods, gentle movement, and relaxation practices. This isn't rebellion against medicine. It's cooperation with it. And it's one of the most practical ways to age well. Now let's talk about safety, because this matters more after 50 than at any other time. Any approach that tells you to stop prescribed medication without medical supervision is a red flag. Any approach that promises cures, overnight healing, or miracle results should raise serious concern. Your health is not a gamble. Responsible holistic practices focus on support, not replacement. Responsible medical care welcomes healthy lifestyle changes instead of dismissing them. The most effective question isn't who is right. It's what combination helps me function better, feel better, and stay safe. That's the mindset shift many people make in their 50s, 60s, and beyond. Another important factor is trust. Some people trust doctors more because of science and testing. Others trust holistic approaches because they feel listened to and understood. Both experiences are valid, but trust should never replace verification. Ask questions. Understand why something is recommended. Make sure every professional you work with respects boundaries and communicates clearly. You deserve clarity, not confusion. And remember this: aging well is not about chasing perfection. It's about consistency. Small daily habits often do more for long-term health than dramatic interventions. That's where holistic thinking can be incredibly helpful, as long as it stays grounded and realistic. At the same time, modern medicine offers tools that previous generations never had. Early detection, monitoring, and evidence-based treatments save lives every single day. You don't have to choose one path forever. You're allowed to adapt as your body changes. For many people over 50, the smartest approach is not holistic versus medical. It's holistic plus medical, used thoughtfully, safely, and with common sense. Your health journey is personal. What works for someone else may not work for you. The goal is not ideology. The goal is feeling stronger, clearer, and more confident as you age. And that confidence comes from understanding your options, not fearing them. Before we wrap up, let me say this clearly. This channel is about education, awareness, and practical thinking, not medical advice. Always consult qualified healthcare professionals for diagnosis and treatment decisions. But knowledge gives you power. And understanding how different approaches fit together helps you make better choices. If this video helped you think differently about holistic healing and medical care after 50, give it a thumbs up. Share it with someone who's confused about their health options. And subscribe to Health After 50 for clear, balanced conversations about aging well. Pinned below, I've asked a simple question, and I'd really love to hear your experience. Do you lean more toward holistic habits, medical care, or a mix of both? Your story might help someone else feel less alone. Until next time, take care of yourself and take your health one thoughtful step at a time.